Hello, I am Becky Brody from the Department of Clinical and Preventive Nutrition Sciences, and I'm going to share today about a project born out of work that my colleague Dr. Jason Stevens and I developed for a Leadership and Change course called Prairietown Regional Medical Center. You may have heard me present on this at the faculty retreat or a WIP last fall. Some faculty expressed an interest in using the SIM, but we decided the focus of our SIM was too narrow, emphasizing nutrition and dietetics leadership. So this summer, I worked on building the Rutgers University Health System, or RUHS, simulation project. It's a faculty development resource designed to bring clinical education to life through immersive, scenario-based learning. RUHS is a fictional leading academic health system based in Newark, New Jersey, and the project provides a dynamic environment where faculty can design simulations that mimic real-world healthcare. So this morning I'll describe the RUHS AI-generated virtual healthcare system and the current pilot testing we're conducting using the RUHS Faculty Simulation Builder and the student-facing RUHS Role Play Simulation Builder, and demonstrate how faculty can use these tools for teaching and engagement. Why did we build the simulation? We have a growing need for interactive, flexible, scalable learning tools, and currently there are challenges with traditional simulation such as resources, cost, time, and realism. The RUHS simulation fosters interprofessional collaboration and scholarship opportunities and bridges classroom learning with realistic healthcare practice. It also models creative, innovative, and ethical use of AI for teaching. This slide depicts the evolution of the RUHS simulation. It started with our original hospital simulation, PRMC, that focused on nutrition and dietetics practice and leadership. This led to the development of an expanded healthcare system and two custom GPTs, one that is faculty-facing to build student activities within the simulation, and one that is student-facing for role-playing with the RUHS characters. We launched a pilot study this fall across 6 departments with 10 faculty for proof of concept and refinement. In the RUHS simulation project, the GPT, built using ChatGPT and EDU, the Rutgers EDU license, it's customized to act as a simulation builder and role-play engine for faculty. Faculty use the GPT to design activities such as an unfolding case study, interprofessional rounds, or patient interviews. The GPT helps structure the prompts, aligns activities with competencies, and weaves in authentic details from the RUHS hospital and character dossiers. Once a role play or scenario is built, faculty can copy that GPT prompt for students to use. In this mode, the GPT acts in character as a patient or a clinician or a team member, allowing students to practice communication, decision-making, and clinical reasoning in a safe, simulated environment. After an interaction, the GPT can provide structured feedback or summaries. So for example, it might highlight a student's communication strengths or note where clinical reasoning could be sharpened or suggest how interprofessional collaboration could be improved. In this way, the GPT serves as both a creative partner for faculty and a simulation partner for students. RUHS is a healthcare system in Newark, New Jersey. It's informed by 2020 census data. It's a leading academic hospital network serving Newark and beyond with 3 main hospitals, Rutgers University Hospital, RUHS Children's Center, and the RUHS Specialty Center. It has several outpatient clinics and community health centers, including an academic research center. We currently have over 25 characters, including hospital leaders, managers, clinicians, students, and patients. The background information and character dossiers are in Canvas in our AI in Education course that has instructions, resources, and a growing repertoire of sample activities built from the SIM. You can see some of our images here with the RUHS health system, a couple patients on this slide, an epidemiologist, a nutrition student, a PA student, our chief medical officer, as well as a physical therapist. Here's the current state of our pilot study. The base model, custom GPTs, have been built and tested. There are 10 faculty that are piloting the sim now, and our exceptional instructional design team have built a Canvas shell to house our content, including instructions and resources. Faculty and students are completing the pre-engagement surveys this fall. We have about 100 students so far that have completed the pre-surveys. Faculty will build their activities and add the content to their courses. They may already have done that, and use the activities live in their courses. They share the role play custom GPT link if they've built a role play with students, and the prompts with their students for them to role play. And then faculty will share their outputs from the activity building to help us build a repository of activities. And they'll complete a post-activity engagement survey as well as their students. And then we'll see how we can evaluate the outcomes in January and then scale this up in 2026. You can build ethical dilemmas, role-play activities, IP scenarios, difficult conversations, research ethics scenarios, interviewing and counseling practice, case studies, etc. If you imagine it, we should be able to make it work. So what does this all look like? When you receive the link for the custom GPT, you'll start by answering some key questions to help you build an activity. You can upload key documents such as a syllabus or competencies or standards of practice to help inform the activity. You can tell it what characters you want it to use. The more details you provide, the better. So in this case, I uploaded some standards of practice because I wanted to develop an activity for a clinical nutrition course for graduate nutrition students becoming RDs. The activity should revolve around an ethical dilemma where the student is being asked to perform activities outside their scope of practice. So again, I informed it what I was providing it, and I asked if it could help me create an activity that can be used in a live Zoom session with students, and it should take place in the hospital. So this was the activity that it came up with. When you get your sample activity, if you like it, great. If you don't like it or you want to change it, you let it know what you want to change. So for this activity, it developed a simulation called Outside the Lines, which was a scope of practice ethical dilemma, and it explains the format of it, how long it will take, and where it's going to be taking place within the RUHS hospital. So then I can take a look at the scenario and the background information that it provided on this activity, and I can make sure that I like it. This activity is involving Lily Tran, a dietetic student, Tasha Dunbar, the clinical dietitian, as well as Simone D'Angelo, who's an experienced charge nurse. So you understand the characters that are involved. If you want to change that, you can, and it gives a scenario where the nurse is asking that the dietitian student perform something outside their scope of practice. So the goal of this activity is for students to be able to role play and practice what would happen in this situation. So ChatGPT provided a role play and the actual prompt, and what will happen is the students will take this prompt and put this into the student-facing custom GPT, and that will initiate the role play activity. So this could be done live, and it can just give you a script if you want, and some of you as faculty could play different roles, or it can be done with ChatGPT through the role play. Next, you'll see some screenshots of the Canvas shell. It will continue to evolve as we develop the sim more, but currently there are detailed instructions for faculty and students that can be copied into your course, and our background and characters and the images are also available for download if you'd like to use images in your course to enhance the realism of the activity. This is a screenshot of the instructions for faculty, including the step-by-step guide, some example prompts, how to initiate the student role play, and then how to actually do that with audio. And this is a screenshot of the student instructions that can be downloaded and placed in your course if you're using a student role play. And last, this is a screenshot of the page that has our characters. So all of the characters' descriptions are available, and it's broken down into the leadership, the clinical characters, the learners, the support, and the patients. So you can get a sense. And if you have a burning desire to add a new character, you can let us know and we can get that added. Thank you to my collaborators, Jason Stevens, Felice and Niambwe, and Scott Parrott, to the pilot project faculty who are testing out the sim this semester, and to the SOTA lab members who help us move our projects forward. Next up, 2 faculty who are participating in the pilot will share activities that they've built. Lisa Palladino-Kame is up next, and Stephanie Cochran. Thank you.